Section 1. A global imperative. Understanding suicide prevention. Suicide prevention stands as a critical global health challenge, demanding our immediate attention and concerted efforts. It is a multifaceted issue, touching countless lives and leaving a profound impact on individuals, families, and communities worldwide. The World Health Organization recognizes suicide as a serious public health concern, highlighting the urgent need for comprehensive prevention strategies. The gravity of this issue is underscored by the staggering statistics. Suicide claims over 700,000 lives globally each year, making it one of the leading causes of death. These numbers represent a tragic loss of human potential and underscore the profound suffering caused by suicidal thoughts and behaviors. Effective suicide prevention requires a multifaceted approach that addresses the complex interplay of risk factors, promotes mental well-being, and provides timely support to those in need. It necessitates a collective effort involving individuals, families, communities, healthcare providers, policymakers, and society as a whole. By understanding the factors that contribute to suicide risk, promoting mental health awareness, and fostering supportive environments, we can work towards creating a world where suicide is preventable and individuals feel empowered to seek help.
Section 2. Unraveling the complex web, proximal and distal risk factors. Suicide is rarely caused by a single factor, but rather by a complex interplay of various risk factors that can be categorized as proximal and distal. Proximal risk factors are those that occur close in time to a suicide attempt and often involve an immediate crisis or trigger. Distal risk factors, on the other hand, are those that occurred further in the past and contribute to an individual's vulnerability to suicide over time. Examples of proximal risk factors include a recent relationship breakup, a major financial setback, or the death of a loved one. These events can create intense emotional pain and feelings of hopelessness, increasing the risk of suicide in vulnerable individuals. Distal risk factors, such as a history of childhood trauma, mental health conditions, or a family history of suicide, can significantly increase an individual's susceptibility to suicidal thoughts and behaviors. These factors often interact with each other and with proximal risk factors, creating a complex web of vulnerability. Understanding the interplay of proximal and distal risk factors is essential for developing effective suicide prevention strategies. By identifying individuals at risk due to distal factors, we can provide early interventions and support systems to mitigate the impact of potential proximal triggers.
Section 3. The mental health connection. A critical component in suicide prevention. Mental health plays a pivotal role in suicide prevention, as the majority of individuals who die by suicide have an underlying mental health condition. Depression, anxiety disorders, bipolar disorder, and substance use disorders are among the most common mental health conditions associated with suicide risk. Mental health conditions can significantly impair an individual's ability to cope with stress, regulate emotions, and make sound judgments. They can create feelings of hopelessness, worthlessness, and isolation, which can contribute to suicidal thoughts and behaviors. Recognizing the signs and symptoms of mental health conditions is crucial for early intervention and suicide prevention. Changes in behavior, such as withdrawal from social activities, loss of interest in hobbies, increased irritability, and changes in sleep or appetite, can be warning signs of an underlying mental health issue. Encouraging individuals to seek professional help for mental health concerns is paramount. Mental health professionals can provide therapy, medication, and other support services to help individuals manage their conditions, improve their coping skills, and reduce their risk of suicide.
Section 4. Scars that run deep. Childhood trauma and its impact on suicide risk. Childhood trauma, including physical, emotional, or sexual abuse, neglect, and exposure to violence, can have long-lasting and devastating consequences, increasing the risk of suicide later in life. These adverse childhood experiences can disrupt brain development, impair emotional regulation, and lead to a heightened stress response. Individuals who have experienced childhood trauma may struggle with trust, intimacy, and self-worth. They may have difficulty forming healthy relationships and coping with stress, making them more vulnerable to mental health conditions and suicidal thoughts and behaviors. Addressing childhood trauma is essential for suicide prevention. Trauma-informed care, which recognizes the profound impact of trauma and emphasizes safety, trust, and empowerment, is crucial for providing effective support to those who have experienced such adversity. Creating safe and supportive environments for children, promoting positive parenting practices, and providing access to mental health services are essential steps in preventing childhood trauma and reducing the risk of suicide in later life.
Section 5. The copycat effect. Understanding the influence of media on suicide. The media, while playing a vital role in informing the public, can also have an unintended influence on suicide rates through a phenomenon known as the Werther effect or copycat suicide. This effect refers to the observed increase in suicide rates following media coverage of suicide, particularly when the coverage is sensationalized, romanticized, or lacks responsible reporting guidelines. Research has shown that exposure to media reports of suicide can trigger suicidal thoughts and behaviors in vulnerable individuals, particularly those who identify with the deceased or the circumstances surrounding their death. This effect is believed to be more pronounced when the coverage is prominent, repetitive, or provides explicit details about the suicide method. The Werther effect highlights the importance of responsible media reporting on suicide. By adhering to established guidelines, such as avoiding sensationalism, providing accurate information, and emphasizing help-seeking resources, the media can play a constructive role in suicide prevention. Section 6. Responsible reporting. Navigating the delicate balance in media coverage. Media professionals have a critical responsibility to report on suicide in a manner that minimizes harm and promotes suicide prevention. Responsible reporting guidelines, developed by organizations such as the World Health Organization and the American Foundation for Suicide Prevention, provide evidence-based recommendations for covering suicide in a safe and informative way. One key principle is to avoid sensationalizing or romanticizing suicide. Portraying suicide as a glamorous or heroic act can be particularly harmful to vulnerable individuals, who may be more likely to identify with such depictions. Similarly, using headlines that sensationalize suicide or include graphic details about the method can increase the risk of copycat suicides. Instead, media coverage should focus on providing accurate information about suicide, including risk factors, warning signs, and available resources for help. It is essential to emphasize that suicide is preventable and that help is available for those who are struggling. By providing this information, the media can play a constructive role in raising awareness and encouraging help-seeking behavior.
Section 7. Building resilience protective factors that can help prevent suicide. Protective factors are characteristics or conditions that can buffer against the risk of suicide. These factors can be individual, familial, or community-based and can help individuals cope with stress, build resilience, and maintain hope in the face of adversity. Strong social connections and supportive relationships are among the most powerful protective factors against suicide. Feeling connected to others, whether it be family, friends, or community members, can provide a sense of belonging, purpose, and hope. Conversely, social isolation and loneliness are significant risk factors for suicide. Other protective factors include access to mental health care, a sense of purpose or meaning in life, cultural or religious beliefs that discourage suicide, and problem-solving and coping skills. By promoting these protective factors, we can help individuals build resilience and reduce their vulnerability to suicide.
Section 8. A holistic approach. The importance of a 360-degree view. Addressing suicide requires a comprehensive and holistic approach that encompasses prevention, intervention, and postvention efforts. This 360-degree view recognizes the interconnectedness of various factors that contribute to suicide risk and the need for a coordinated response. Prevention efforts aim to reduce the incidence of suicide by addressing underlying risk factors, promoting mental health, and creating supportive environments. This includes programs that promote social-emotional learning in schools, anti-bullying campaigns, and initiatives to reduce access to lethal means of suicide. Intervention efforts focus on providing immediate support to individuals in crisis or who are at imminent risk of suicide. This includes crisis hotlines, mobile crisis teams, and emergency psychiatric services. Postvention efforts aim to support individuals and communities affected by suicide. This includes providing grief counseling, support groups for survivors of suicide loss, and training for gatekeepers such as teachers, clergy, and first responders.
Section 9. Community as a lifeline fostering support networks for suicide prevention. Communities play a vital role in suicide prevention by fostering supportive environments, providing access to resources, and promoting help-seeking behavior. By working together, community members can create a safety net that catches individuals in need and connects them to appropriate support. Gatekeeper training programs can empower individuals in various sectors, such as education, law enforcement, and faith-based organizations, to recognize the warning signs of suicide and refer individuals to appropriate resources. Support groups for individuals who have lost loved ones to suicide can provide a safe and supportive space for sharing experiences, coping with grief, and finding hope. Community-based mental health services, such as drop-in centers, peer support groups, and mobile crisis teams, can provide accessible and timely support to individuals in need.
Section 10. A collective responsibility. Call to action for a suicide-safer world. Suicide prevention is not solely the responsibility of healthcare professionals or mental health advocates. It is a collective responsibility that demands the attention and action of individuals, families, communities, and society as a whole. By working together, we can create a world where suicide is preventable and individuals feel empowered to seek help. We can all play a role in suicide prevention by learning the warning signs of suicide, reaching out to individuals who may be struggling, and promoting help-seeking behavior. Let us remember that behind every statistic is a human life, a story of pain, and a family shattered by loss. By fostering empathy, compassion, and understanding, we can create a world where every individual feels valued, supported, and hopeful.